Some parts of life can be hard enough to afford when you're healthy, but imagine a sickness costing you a lot of money. A survey conducted by Angus Reid for the Canadian Cancer Society shows that 2/3 of Canadians believe a sudden cancer diagnosis would make it difficult to manage their household finances. We're now joined by Wilson Cull, the Director of Advocacy at the Canadian Cancer Society. Kelly, thanks for being here. What are some of the out-of-pocket expenses that families find themselves facing when a diagnosis comes?
Yeah, thank you so much for having me. We are really working this World Cancer Day to draw attention to the fact that, we really acknowledge that so many Canadians are dealing with crunch and inflation pressures right now, and cancer patients are really feeling that over and above. On average in Canada, we know that Canadians dealing with cancer pay about $260 per month out of pocket. And these can vary really dramatically depending on the type of cancer that you have, the province that you live in, and also your personal circumstance. So, some examples, many medications particularly that you have to take at home, like anti-nausea medications, the cost for many tests, the cost for home care, for child care, side effect management supplies, things like compression garments and wigs and prostheses. If you're a young person dealing with cancer, you might be looking at fertility options, and the preservation of those things can be very expensive. And of course, and for many people in British Columbia, the cost of travel, particularly from rural and remote communities, can be really devastating on the wallet.
Now, this survey showed 82% of Canadians wanted support systems in place to manage these costs. What are some of the supports they're looking for?
No, it's a really complicated question, I suppose, and the answer is really complicated, and it's going to take a lot of people coming together to figure out a solution to reduce the out-of-pocket cost burden for cancer patients. So it's not one government, it's not one organization, but in this campaign that people can find at cancer.ca/cost of cancer, we're really calling to action on the federal government to implement some measures that we know will help reduce the strain on Canadians. Some examples are implementing national pharmacare that can help reduce the cost of cancer drugs, looking at tax credit options for caregivers, and working with the provinces to ensure that people are protected in their job status while they take time away to receive treatment, and also to reduce some of those out-of-pocket costs that I've just mentioned, things like supplies and testing.
Where do you find more roadblocks when it comes to getting more coverage for people who are diagnosed with cancer? Is it on the federal level or the provincial level?
It's certainly a mix. Some of the examples that I've given are really at the federal level. At the provincial level, there's a couple of levers that we know can be applied. And we also know that there's a lot of inequity province to province around what's covered and what's not. And so we're really looking to provinces to take leadership in terms of, reducing some of those expenses, but also to look at job protection as another file that we're really working to advance in provinces. We know that a number of Canadians do not feel confident. It's actually 27% of British Columbians who responded to our survey indicated that they did not feel confident that their job status would be protected while they took the time required to go away and receive that cancer treatment. And so it's really this mix in the situation where you're facing a lot of out-of-pocket costs, additional out-of-pocket cost pressures, and also you might be taking time away from work and you might have a reduction in your income. Those two pressures can be quite crushing, and we need to ensure at the very least that Canadians and British Columbians know that their job status is protected while they're taking time away from work to receive treatment.
Kelly Wilson Cull with the Canadian Cancer Society. We appreciate your time and your perspective. Thank you.
Thank you.